My name is Edia Kawola. I was born and raised in Tonga, and I moved to Niue in 2011, July 2011, as a chief medical officer. And later in 2018, they also appointed me to the director of health role. Thank you very much, everyone. The dream is almost become a reality now, because Hazel and I, we have written to WHO to ask them to declare hepatitis to be eliminated from Niue, and hepatitis, viral hepatitis, top of the list.
The ability to eliminate viral disease like that, it's a first step, but it shows there's a path. And then you start to think about other viral diseases. If we can get to that point, it's a pretty dramatic shift.
Hepatitis is one of the most devastating diseases on earth, but it's also one of the most preventable and treatable, with services that can be delivered easily and cheaply at the primary healthcare level. And several countries have participated in hepatitis elimination pilots, which will help WHO establish the validation process for certifying elimination. However, despite these successes, most countries are still not on track for elimination by 2030. The reasons people miss out on services for hepatitis are the same as the reasons they miss out on other health services. Accessibility and affordability because of who they are, where they live, or how much they earn.
One of the things people don't recognise is the miracle that was sofosbuvir, which is the drug that treats hepatitis C. It's the key molecule. Prior to that, we had drugs that would treat viruses. So say you got a cold sore or cold sores in private places, we could give you some medication and they would go away. But they weren't cured. So when this molecule was developed, it was an absolute breakthrough moment. It's a penicillin moment. So it's our first ever cure for a virus. And what it did was open people's eyes to the fact that if you get it right, you can cure stuff. So potentially we could cure HIV, potentially we can cure Hep B. And this has shown that it is possible if you get it right. So that was truly remarkable. And I think people have missed that this is literally in the order of as important as the invention of penicillin.
And the societal cost to the society as a whole, because they're more tired, because they're actually more likely to miss work, was 10 to 20 times higher than the direct cost, actually. And by direct cost, I mean the actual cost of buying the diagnostics, the treatment, and the cost saving from hospitalization.
Ko mātua Anaki Goodall from Ngaitahu in Christchurch. He came here and it's such a beautiful place. He got talking to some of the people locally and he came back and he said, couldn't we do a whole country? Couldn't we do a whole island? Because the World Health Organization has set the target of 2030 to eliminate viral hepatitis from the world.
2030 targets are important because it gives the world a focus and a way to really measure our progress. We know we have the tools to eliminate hepatitis B and C. For B, we have an effective treatment and a vaccine. And for hepatitis C, we have very effective tests and a cure. So by keeping our eye on the 2030 targets, we can all work towards a future without hepatitis.
In places like New Zealand and Australia, we have high rates of hepatitis C, smaller rates of hepatitis B. But if you look at our Pacific neighbours, they have lower rates of hepatitis C, but very, very high rates of hepatitis B. In fact, they have the highest rates of hepatitis B in the world. And hepatitis B and hepatitis C are the leading causes of liver cancer and liver death around the world. So if you live in the Pacific, be it Tonga, Niue, the Cook Islands, or Samoa, your risk of having hepatitis and of dying from hepatitis is more than 10 times that for people living in Western countries.
These are not trivial viruses. The risk of developing cancer from hepatitis B and C is actually the same as if someone smoked 1 pack of cigarette per day. So we go into debates about, well, we need to screen people and we need to treat. I think the other aspect that's very unique about hepatitis B and C is that the elimination of these infections are cost saving. Most of the countries that we work with are struggling, and what they're worried about is how do we pay for it? And then the second part is how do we actually implement? And that's where Hazel's program was so important, because they actually went and showed them how to do the screening and treatment. And that's what countries need. They need actually country navigators to go in there and actually help them develop these elimination programs. The one thing that's common across all the countries who are on path to elimination is a commitment to action.
My name is Alice Lee. I'm a professor of medicine, a gastroenterologist and hepatologist, which means I deal with gastrointestinal diseases and liver disease. I'm based in Sydney, and I'm a clinical lead in one of the teaching hospitals. I take care of a lot of people with liver disease, including liver cancer, complications of chronic liver disease. I had the fortune of setting up a small organisation called Hepatitis B Free about 10 years ago. And this organisation has allowed us to support some hepatitis B needs in the Pacific Islands. And where it becomes evident, we also work with supporting hepatitis C needs, as well as other forms of medical support as requested by our partners in country.
My name is Sione Limba Mawaitangi. I'm from Tonga, and I'm a nurse at the Niue Hospital. Still remember growing up, on my mom's side, it's really strong, the disease on my mom's side. At the time, we don't know what it is. We only know it's a liver problem. They always got sick. All of them have the same thing. All the body start wearing away, muscles wearing off, and big tummy and turn yellow. It was scary, trying to go help them. But every day, every night, you hear them crying with pain, and slowly you see the blankets we keep on them start turning yellow. All their body starts shrinking, but the tummy gets big. If you know a family member gets it, it's pretty much end of the line for them, and there's no more hope because we don't have anything else to give them at the time.
It's been a real privilege to be in Niue. It's a very small island and the population is less than 2,000. When I heard about the rates of Hep B in Niue, I was blown away, because a nationwide zero survey that was done showed that we've got less than 0.5% compared to the rest of the Pacific Islands, where the rates are ranging from 7 to 15, 20% in some places. And a publication in 1983 shows that Niue had a prevalence of hepatitis B of 11.9%. And that was from a zero survey done with most of the nation surveyed. So it's a similar kind of scenario. So, wow, something happened in the last decades where they drove that rate down from nearly 12% to less than 0.5%. And so we started to ask the question, what is it that is unique to Niue?
I was one of those people who helped start up the program with the immunization, and that was something about 1985. There was a group of people who came from Melbourne, and they did a survey and they found out that Niue is one of those countries who have a high, either you are infected or immune. So from that, they started the immunization program, and they provide us the vaccine.
Thank you to everybody for having us here in Niue. It's our first time. Our training is to just to give you a snippet of viral hepatitis and know that all of these resources will be available, and this is really the tip of the iceberg in terms of the resources that we have.
Theoretically lose 80%. Because we've got such a small team, we wear many hats. Having the team come over and having like face-to-face interaction with the staff, it gives us an opportunity to ask some of the questions that we would want to get like prompt answers for, especially when we don't have the specialty in the area of liver health.
Messaging has been, we'll help you set up. What do you need for us to help you set up? Only if you feel that it's sustainable beyond what we can do in the beginning. We don't believe that our role is to take over. Our role really is to trigger and help implement a new program and for it to be integrated into the current systems. So one of our primary goals is to ensure that the drugs are on the essential medicines list, and that means it becomes part of the nation's healthcare budget. So just because you have Hep B doesn't mean you have a death sentence. And this is a really important message as well, because if you have Hep B and you don't know what it means, then you might think that this is it, my life is over. And if we can't counsel our patients and give them the right information, it will have such an impact in their lives. I have patients who have said to me, I'm not going to get married, ever, in case I give this to my partner or their children. And that's because they got the messaging wrong somewhere in their life. And it's really sad.
When I first heard back in 2012 that I have the hepatitis B, it was very stressful, and sometime at one point I wanted to just end my life like that, because I don't know what to do, and I don't want to live and pass it on to my families or pass it on to my kids. It's very stressful. Yesterday when I was finally getting to hold the bottle, the treatment, yes, I was thinking back. Maybe it was God's plan all along. Like, when I was crying every day, looking for help, now I know that He heard me. Which is why I think it was a blessing for me. It was a blessing for me to come to Niue.
We are talking about a disease that is rampant. There are nearly 1 million deaths per year from hepatitis-related complications. One person dying in less than 1 minute. But the exposure and the understanding and the awareness for this illness is still not there.
Having countries achieve their elimination goals definitely causes a snowball effect, because countries look at their neighbors and decide what they should be doing in terms of health and other social issues. So it's so important that we have these kind of vanguard countries leading the way in the global fight against hepatitis.
We have a population in Kiribati and an outer island where the prevalence of Hep B is around 16%. Because the prevalence is so high, it's just not acceptable. And the only way we're going to be able to control the disease is pure elimination, get rid of the virus on the island. So everyone that has hepatitis B, confirmed on a surface antigen, goes on to treatment. Some of the medical assistants don't have all of the technology. They don't have the ultrasound, they don't have the AST, they don't have the platelets, they don't have the APRI. And you don't want to wait till the patients are decompensated and they're obviously cirrhotic. So this is what we are proposing. So in places like that, that is a model. You can't have drugs, which is safe, because we don't have a viral load test. And you're never going to get access to a viral load test. Or maybe you'll get access to it in 5 years. And maybe by then it'll be too late. So I think you've got to think about ways to ensure that there is equity in healthcare. And that's kind of why we feel so strongly about this program.
But we still want to really do something to help those 12-20% of people who are living with the virus that need help, treatment, connection to care in other parts of the Pacific.
A lot of the Pacific Islands have so many challenges. And if you look at the challenges in sort of categorical ways, from a healthcare point of view, you have the financial challenges. There's a very limited healthcare budget, so there's no money for this. And we have to carve out a section of the healthcare budget to implement some of these programs. You don't need an army, you just need a trigger. You need these champions, and each country, you just need one champion. What we've been able to do now is to really slim down the program so it is highly cost effective.
The World Health Organization Pacific region has been quite active, has been a real partner in this effort. Unfortunately, the World Health Organization is chronically underfunded.
There are few diseases that we can realistically dream of eliminating, but hepatitis is one of them. Sustained funding, relentless advocacy, and visionary political leadership will be essential for realizing that dream.